Next speaker would be Dr. Richard Joseph. He's a colleague of mine, and we have worked together and shared patients together. That's wonderful to have colleagues who are quite nice. He will share with us what's new in the management of renal cell cancer.
Thank you, Winston. Really glad to be here, and thanks everybody for coming. So we're going to do a quick update in renal cell carcinoma. Go through my potential conflicts of interest. And really, these are, I just wanted to kind of keep it simple today and cover really two main questions. And the first one is, what is the best first-line agent to use in patients with metastatic disease? That landscape has changed a lot in the last year. And then I think the other big topic, which was a plenary at ASCO this year, is what is the role of cytoreductive nephrectomy? So the first thing I want to start with before we go there is to emphasize the importance of risk stratifying patients with renal cell carcinoma. As most everybody in the room is aware, we've had at least two systems to stratify patients in the past. One was the MSKCC or the MOTSR, and more recently is the HANG or the IMDC. And they have very similar overlap, but you can see them here as mainly the time of diagnosis until you initiate systemic therapy, performance status, hemoglobin, high calcium, high neutrophils, and high platelets. And until recently, these were not very helpful in making clinical decisions, but just really helping to guide patients what their potential prognosis would be. So if you look here, this is the median survivals for patients with low, intermediate, and poor, and this is based on the MOTSR or the MSKCC model. And you can see there was a difference, but again, not very helpful in making decisions. And then if you have this was the updated version in a phase 2 study using the MSKCC model. And you can see, everybody knows that there's those favorable risk patients that are, alive at least 3 years median versus the intermediate and poor, we're talking 2 years and 1 year. And then if you use the HANG criteria, you see similar numbers, a median survival of favorable around 37 months, intermediate 28, and poor 9 months. Okay, so let's go with a case that I've had recently in the last year. It's a 46-year-old female. She presented with, she had no past medical history, presented with a cough. Imaging revealed multiple bilateral pulmonary nodules and a large mass in her left kidney and a lesion in her L1. She did undergo a nephrectomy, which revealed clear cell, RCC, grade 2. She did have